Could you please introduce yourself?
I am not that obscure. You have probably heard of me. My name is Human Immunodeficiency Virus. HIV is the acronym.
What are your main modes of transmission?
I am transmitted through bodily fluids, like seminal fluid, vaginal secretions, blood, and breast milk. Some people erroneously think that I can be contracted through saliva or casual contact.
So, saliva is not a mode of transmission?
No, one would have to consume an absurd amount of saliva, something like a gallon, and probably have an open wound in their mouth to contract me through saliva. Even though I am a sexually transmitted disease, because I am transmitted through blood, injection drug users who share needles are also at high risk of contracting me.
Do you think there are some misconceptions about you?
Indeed, first, receiving a blood transfusion is not a common way to contract HIV. Clinics are very careful to screen. Also, I think because in the past I was stigmatized as an infection that appeared in only certain communities, that many people think they can ignore me. In reality, 39% of new infections in the US occur in young people between 13 and 29 years old.
But you are a pretty serious infection, so you probably have symptoms, right?
That is actually false. About 25% of people I infect have no idea they have been infected. Some people may experience flu-like symptoms at the onset of infection, but then nothing for years. If left untreated for long enough, I attack cells that help the body fight disease, and I progress into AIDS, acquired immune deficiency syndrome.
That sounds pretty serious. What might someone do if they are worried?
Well, that is how I am tricky. It takes at least 3 months after potential exposure to get an accurate reading on a test. So for anyone who has multiple partners, testing is recommended every 6 months or 3 months after potential exposure. The test can be a rapid test with a finger prick or oral swab or a full blood draw.
Can you please tell me a little bit more about AIDS?
Well, I am not a death sentence. There is no cure for me yet, but medications have been developed to help with symptoms. These medications must be taken every day, but people who get diagnosed early and maintain a treatment regimen live productive lives with an HIV-positive status.
Thank you very much, HIV.